I'm Penny Robinson. I'm a lecturer in the School of Public Health and Preventive Medicine. My Twitter handle is PennyRobOz, and I love using Twitter, so this is a short video to tell you why and how I find it so useful. Twitter is a form of social media that originally had 140 characters. Now, recently, it's been increased to 280. This image shows how many tweets in English reached the limit before the change. I can tell you that I had to do a lot of editing to get a 140-something tweet to the limit. One way I use Twitter is to quickly share interesting articles I find in the media. Mostly they're public health related, but other times they're just interesting articles. I also use Twitter to live tweet seminars. Sometimes, if you tag the right people or the right account, you'll get a response. 2 years ago, there was a seminar on public health surveillance and social media. I tagged the WHO, and a couple of hours later, they actually responded to my tweet and clarified when and how they first used Twitter in public health emergencies. When live tweeting seminars, it's also important to consider using the correct hashtag. In this case, when I used the Ebola hashtag, I heard from someone who is actually from the Democratic Republic of Congo, so on the ground where Ebola is or was, and understood the customs and the importance of funeral ceremonies. So from this brief exchange, I learnt a lot. I also use Twitter for autism advocacy and awareness of issues. At the Asia Pacific Autism Conference in 2015, I was an invited speaker, but I was overcome by the very bright light that was a spotlight. The image on the left was taken by the professional photographer, and 2 years later, if people haven't heard of me in the autism world, a lot of people have heard about the autism girl story, like the hoodie girl story. I also used Twitter to network prior to conferences. At the end of an inclusive education Twitter chat, I asked if anyone was going to the International Teaching Conference in Melbourne in a couple of weeks. A conversation that started on Twitter turned to email. We had a virtually connecting conversation, which is using Google Hangouts that's live streamed onto YouTube. And because Simon Lancaster was tweeting a lot as well, live tweeting at the conference, I cheekily tagged him to say, "Do you want to have a look at this thing?" He's a professor in the UK. At that stage, I was an assistant lecturer. I'm now a lecturer. So not only did he join in this virtually connecting conversation, but Twitter was also a great way for me to connect with someone I might not have otherwise connected with because of him being so much more senior to me. There was a WePublicHealth Twitter chat on the topic of communication in the middle of 2015. In response to sharing a story of showing a brief email about my uncle's death that day, on my phone to people while I was still processing the news. I couldn't say it. In that Twitter chat, within a couple of minutes, I was told about an app called Emergency Chat. App on my phone and on my tablet, and I regularly share this app info on Twitter as well as Facebook and in person, so others know about it too. So Twitter chat enables you to gather information and also share information. So in summary, why do I use Twitter and love Twitter? It enables me to share interesting media articles quickly, live tweet seminars and conferences, which helps with my networking. In the autism advocacy space, it enables me to share my personal experience, network locally and a bit internationally, and as someone on the autism spectrum, I find networking at conferences when it's really loud and noisy at meal breaks harder than some other people. So having connected via Twitter often helps me do that networking at conferences. If you want to know any more information, you can contact me on Twitter at PennyRobOz. Thank you.